It is Mental Health Awareness Month, a reminder for all of us to pay attention to our own well-being, check in on loved ones, and take a more active role in our mental health, rather. Dr. Rhonda Randall is the EVP and Chief Medical Officer at UnitedHealthcare. Welcome.
Thank you.
I'm happy to have you here. So tell me, how would you describe the current state of mental health in our country?
Well, we know that mental health has been a challenge for many of us, particularly for adolescents, for women, for seniors, and for multiracial adults. And in kids, we really want to pay attention. You know, the US Surgeon General earlier this year called the mental health condition around adolescents in our country a crisis.
You know, previously there was a real stigma surrounding mental health care. I'm wondering if that is still the case, and if so, how can we break down those barriers?
Yeah, I think we're starting to see some really good improvements in decreasing the stigma. There's been really a multifactorial call to action around that. I think we're seeing younger generations more comfortable talking about mental health and recognizing that it is health. And some of the changes where in the past we've really separated mental health care from physical health care, and recognizing that the two of them are very much integrated.
So what are some of the signs that you or a loved one rather may be depressed or in need of some mental health assistance?
Yeah, sometimes it can be subtle, sometimes it can be more obvious. Certainly if somebody is in a crisis, want to get support right away from either a crisis line or if you need to be cared for urgently, make sure that that's the first thing that you're looking for. But often you're starting to see subtle signs and wondering, is this something that I need to be worried about? Is it something more serious? Do I need additional support? The big things that we look for are helplessness and hopelessness, feeling like there isn't hope. And a lack of feeling pleasure, right? The lack of feeling happiness in your life. But more subtle signs can be changes in our sleep patterns. It can be changes in our eating patterns, either eating more or eating less. We could be sleeping more or not sleeping enough. It could be in a child, for example, a significant difference in their academic performance, in their social support networks, and so forth. So when in doubt, have a conversation. There's a lot of places to get support.
And once you know that you need help, where should you go to get that help?
Yeah, there's no wrong place to start. What you want to try to avoid is ending up in a crisis. I think you don't want to end up in the emergency room, for example. So for a child at a school, most schools now have on-site licensed mental health professionals that can be a good guidance to help you where to get started. Another place I always refer parents or older adults is their primary care physician. Primary care physicians are trained in how to do this kind of screening, often can get some of the treatment started early for you and provide referrals when necessary. You can also start by calling the number on the back of your insurance card. Your employer may have purchased for you employee assistance program benefits. Often they include free counseling and sometimes help with the stressors in our lives, like financial counseling or when we need legal counsel, or support for some social needs, for example.
Perfect.
So there's a lot of places to get started.
And where can we go for more information so that we can get started?
You can go to UHC's newsroom. We have great information on there. Also, applications like a Sanvello app where you can get self-help information, self-help for those stressors. That's a good place to start as well.
All right. Thank you so much for being with us today, Dr. Randall. We appreciate it. We'll be right back with more Midday Maryland right after this. Stay tuned.